أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Assalamu alaikum to everyone who is watching this video. Today's video-based lecture is about the levels of prevention, the primary prevention, the secondary prevention, the tertiary prevention, and the primordial prevention. We will be discussing these concepts one by one in detail with common examples. So inshallah you will understand very easily. Let me show you the slides and we will discuss them. So level of prevention, these are the objectives. Define prevention, discuss the level of prevention, describe the primordial and primary level of prevention, and discuss primary and tertiary level of prevention. The goals of medical sciences are to promote health, preserve health, restore health, and minimize the suffering and distress. Promotion of health, you are healthy, but you are trying to further promote your health, to reach to the highest level of health. Preserve health, whatever the health, a normal life you are living, you have to preserve that and prevent it from deteriorating. Restore the health, what you were before the disease, you have to bring yourself back to that condition. So that is restoration of health. Minimize so that you can perform the normal function. Minimize the suffering and distress, the suffering, the pain, and the sign symptom that a person has. So the basic goals, the goal of medical science is to minimize those signs and symptoms in the diseased person. These goals are embodied in the word prevention. So all these goals, it is promotion, it is preserving of health, restoring of health, is embodied in the word prevention. The action of stopping something from happening are arising, that is the definition of prevention. Action and intervention that you do to prevent something from happening. Here, when we talk in terms of health sciences or medical sciences, we talk about the diseases so that we can take an action to prevent the development of the disease or occurring of a disease. That is the primary prevention. Disease prevention refers to deliberate actions to halt or delay disease progression from one stage to the next stage. As in the previous lecture, I have discussed the natural history of disease. So there are different stages: susceptibility, then the preclinical stage, the clinical stage, then the stage of diagnosis, to diagnose the disease, and then the treatment. And later on, if there is no treatment available, disability, and finally towards death. So each step is very important in the natural history of disease, and each step is to be intervened on to prevent the disease from progressing towards the another stage or another step of the disease. The prevention of disease obviously has a potentially greater impact on public health than medical care. It is generally said, a common saying, that prevention is better than cure. So when you prevent a disease, you are protecting a mass population, or you are preventing the public from getting a disease. And whenever it comes to the stage of medical treatment, it is so costly that a poor country like us cannot afford if a mass population gets the disease. Exactly, nowadays, the best example is the coronavirus, the COVID-19, which was so difficult for us to combat with. So a country which has limited resources, less resources in terms of material and human resources, they cannot combat with these kind of fatal infectious diseases. So by prevention, if we follow the SOPs, especially for COVID-19, we can prevent it from further progression or from further spreading. And in case of primary prevention, we can prevent the diseases through vaccination, other modifying factors. If we can modify, the modifiable factors are modified, and we can prevent so many diseases. So there are 3 levels of disease prevention called primary, secondary, and tertiary. A 4th level called primordial prevention was later added. This 4th one was later added. In the early stages, we were talking about only these 3 types of prevention. But now 4th one, which is very, very important, that is a primordial prevention, and that is the development of the risk factors. For example, obesity, sedentary lifestyle, your pollution, and so many factors that put you prone to develop a disease. So the overcoming and from the prevention of those risk factors from occurring is called primordial prevention. Primordial prevention, it is the prevention of emergence or development of risk factors in population in which they have not yet appeared. Primordial prevention consists of measures that inhibit the emergence of risk factors in the form of environmental, economic, social, and behavioral conditions and cultural patterns of living, etc. So basically, it talks about the risk factors, and the risk factors may be poverty, it may be pollution, it may be social isolation or deprivation, and it may be behavioral condition, for example, unhealthy behavior. It may be a cultural shock as well, cultural patterns of living. So whatever in the culture exists and that promote the development of the disease, we have to work on it. So that is a primordial prevention. The main intervention in primordial prevention is through individual and mass education. Primordial prevention targets the whole population rather than an individual group of population rather than an individual one. The peoples are assembled or through television channel. You can teach the mass population for primordial prevention to take an action so that they can prevent the risk factors from its development. Primary prevention aims to prevent the disease from occurring, and primary prevention seeks to reduce. This is now after primordial prevention, we have a primary prevention, and primary prevention is done when you have the disease, when there is no disease in question. So before the development of the disease, this step is taken. This prevention is done. Primary seeks to reduce the frequency of new cases of disease occurring in a population, and thus is most applicable to persons who are in the stage of susceptibility. Those people who are susceptible, for example, who have unhealthy behavior, who are with low immunity, who have already comorbidity for some diseases and the other diseases you want to prevent. So these are susceptible people. Specifically those people who are, for example, with low immunity and unhealthy behavior, and they yet to develop the disease. So before the development of the disease, you take an action to prevent those diseases from their occurrences. It signifies intervention in the pre-pathogenesis phase of a disease or health problem. Pre-pathogenesis, there is no pathogenesis, no damage of the cells of the human body, and you are doing intervention to prevent those cells from getting damaged. Primary prevention may be accomplished by measures of health promotion and specific protection. Health promotion may be through exercise, and specific protection, the best example is vaccination. We will further discussing it in detail, like this about the health promotion. These are the strategies which include health education and health promotion program designed to foster healthier lifestyle, and environmental health program designed to improve environmental quality. For example, sedentary lifestyle. So you have to motivate the person to do exercise so that they can prevent diseases, including hypertension, other cardiovascular diseases. Environmental, if it is a risk for respiratory problem, you have to work on it. The dirty air, polluted air shall be worked on to convert into a cleaner one. So you have to improve the environmental quality. You have to make it clean and neat so that the respiratory problems may be prevented in advance. Specific protection, as I have talked about it. Specific exam primary prevention exclude immunization against communicable diseases. public health education about good nutrition and exercises. Very important, good nutrition or balanced nutrition, and the exercises, which is very, very important for the health promotion and prevention of diseases. Chlorination and filtration of public water supplies, the drinking water, which has got an importance in the human body function. If you have a clean water, you can prevent so many diseases of gastrointestinal system and that of the kidneys and other systems. And so in that respect, you have to chlorinate and filter your water. And the primary prevention, these are the examples. Like if you convert your lifestyle from sedentary to an active one, you do exercise, you do cycling, you do jogging, you do exercise, then you can prevent these kind of diseases with the diet and with exercise. These are the diet. Which type of diet do you take? You have to take a balanced diet, vegetables and other diet that is important for health, and you can prevent the cardiovascular diseases by these interventions. Secondary prevention attempt to reduce the number of existing cases of health. This is secondary prevention focuses on the early detection and prompt treatment. And this is done through mass screening, a screening test, which is a rapidly applied test and applied to a group of people. And you identify, detect the diseases, and you take an immediate action for treatment so that you can control the diseases and prevent it from spreading to other segments of the population. It is therefore most appropriate aimed those in the stage of pre-symptomatic disease are in the stage of clinical, subclinical disease. In the clinic, even the clinical disease are in the stage of pre-symptomatic when there are no symptoms. More specifically, it is applied the screening test on healthy individual if you talk in terms of screening test. And if you do secondary prevention, you can apply the treatment on apparently symptomatic persons as well. So its purpose is to cover the disease, slow its progression, or reduce impact on individual or communities. When you control the disease and you prevent it from spreading to other people of the community, then you are controlling the disease and it will not affect the other people, and it will reduce the burden on the hospital as well. So secondary prevention in this regard is very, very important. Secondary prevention focuses on early detection and swift treatment, as I have already said, and the specific intervention are early diagnosis and adequate treatment. If you do a diagnostic test for a person and he or she is positive for a particular disease and there is no treatment available, then there is no use of that detection of disease. You must know whether the treatment is available or not. If the treatment is available, then it's working. It is important to go for diagnosis of the patient, of the disease. And once it is diagnosed and it is promptly treated with the availability of the adequate treatment, then you are preventing it from spreading to other parts of the communities. A common approach to secondary prevention is screening for disease. It is search for unrecognized or detect by means of rapidly applied test examination procedure in apparently healthy population. Screening is performed to detect disease early so prompt treatment can be initiated. And that is only done when you have the treatment modalities available for particular diseases. Example of screening include mammography of breast for breast cancer detection, eye test for glaucoma, occult blood test for colorectal cancer, the pap smear for cervical cancer, the prostate specific antigen test for prostate cancer. So these are some of the examples of screening tests for which it is performed to detect the individual these kind of diseases, and then an immediate action is taken to control its spread. Mass screening involves the whole population. Example, measurement the BP of all adults in an individual. So measuring the blood pressure is a very cheaper test. You can measure the blood pressure of mass population and identify those who are hypertensive. Targeted screening for a selected group, anticipated to have an increased prevalence of the condition for which screening has been instituted. For example, measuring the blood cholesterol in relatives of people with familial hyperdyslipidemia. So those families who have high blood cholesterol level, their relatives are then screened for high cholesterol level so that they can be prevented for the development of those diseases which are related to the high cholesterol level. Criteria for screening programs. You cannot carry out a screening program unless and until there is a criteria. And what is the criteria for screening program? Because you are spending money. The government is spending resources on the conduction of screening test. So first you have a certain criteria when to perform a screening test. So there are WHO guidelines for deciding when screening is appropriate, drawn up by Wilson and Jagner in 1968. And this is the criteria. The first one is condition should be an important health problem. It may, make you think about the health problem. That this is an important problem. And how do you know why this is an important problem? If you have a large number of people from a specific community who are getting admission in the hospital for a particular disease, then it becomes a burden on the hospital. And it compels you to think about the prevention and control of this disease. So you have to go to the community from where there is an increase in flux or frequency of a particular disease. And then you have to screen the other individual who are living in that community. That is the healthy individual. The natural history should be well understood, as I have already discussed in the natural history of disease, that there is an importance to know the natural history of disease. So by knowing the natural history of disease, then only you can go for the screening test. If you don't know the natural history of disease, you cannot prevent or control that disease. So it is important to know the natural history of disease. There should be a detectable early stage, and you can detect the disease at an early stage. So there must be an early stage of the disease so that you can detect the disease. There should be a suitable test for the early stage, and a suitable test should be available for this for the early stage. The test should be acceptable to the population to be screened, and that test should be acceptable. It shall not be as much sensitive, sensitive that the people cannot expose themselves to that test. For example, if you directly go to a community and you ask the women to expose themselves for any reproductive problem, that is for pap smear, they will not expose themselves. So first, you have to have a knowledge of the test, whether it is acceptable to the community or not. And if it is sensitive, means the performing of that screening test will not be fruitful. The cost should be balanced against benefits. Whatever the screening test that you are performing, there must be a balance against the risk to the benefits. You have to weigh the risk and the benefits. If there are more benefits of the test and less risk, you have to go for that. If there are more risk and less benefits, then you cannot perform the test. Disease treatment. Examples of other secondary prevention methods include treatment of hypertension to prevent complication and removal of skin cancer lesion as they occur. So this is one of the example of the screening test. Whenever you detect the people with hypertension, there are modalities that you can give to the patient, the hypertensive patient, so that they can control. And the other example is the skin lesion. When you remove the skin cancer lesion, you can prevent it, you can control it. Tertiary prevention. Tertiary prevention tries to limit disability and improve function in following disease and its complication, often through rehabilitation. The best example is, for example, a person with paralysis, quadriplegia or hemiplegia, and he or she is bedridden. So whatever you do a rehabilitative program, that is the physical therapy, to bring the patient into a normal one, to restore his or her health. And it will take a longer time. Therefore, it is most applicable during the late clinical stage or the stage of diminished capacity. Aim of tertiary prevention is to promote the patient adjustment to irremediable condition. A person, for example, with a spinal cord injury or with a leprosy, so you can work on that patient to bring him to adjust himself or herself to his or her life. And when it is irremediable, like for example leprosy, it is irremediable when it is in advanced stage and it has damaged the spinal cord, so the patient becomes incontinent. You have to bring the patient to a level of adjustment. Intervention that should be accomplished in the stage of tertiary prevention are disability limitation. This is one of the example. If a person get damage or amputation, then there is that person is disabled, but you have to limit the disability through the adaptation or introduction of certain kind of instruments, for example, artificial legs and so on. So rehabilitation, the combined and coordinated use of medical, this is the example. How do you do the rehabilitation? Medical, social, educational, and vocational measure for training and retaining the individual to the highest possible level of functional ability. A person with amputation not only have a physical problem, but as well as a social, educational, and vocational problems as well, especially the social deprivation and social isolation. So you have to make that person socialize so that he or she may not develop the psychological signs and symptoms. So this is a combination of different aspects: social, medical, educational, and vocational, and so on. Example include the treatment of diabetic to prevention complication of the disease and the ongoing management of chronic heart disease patient with medication, diet, exercise, and periodic examination. These are the best example of tertiary prevention. The combined and coordinated use of medical, social, education, and vocational measure for training and retraining the individual to the highest level possible functional ability, like for medical rehabilitation, that is a combined and coordinated use of vocational rehabilitation, social rehabilitation, and psychological rehabilitation. So all these aspects shall be worked on, and only then you can bring the person to a level of adjustment. Otherwise, it is difficult to bring the person only working on a single aspect, that is a medical aspect, or a vocational, or a social, or a psychological. It is the combination of coordinated use of different types of medical, social, education, vocational measures, and only then you can bring that person to a level of adjustment. So you have to work on all the four aspects. The natures of disease and the levels of prevention are closely linked. When, where, and to whom apply levels of prevention. So it is also important. It is also important that you should know when to apply, where to apply, and to whom, a segment of the population, or whether they are meeting the criteria for the prevention or not. So clinical course of a disease, pre and post disease stages, the etiological phase, social and environmental determinants. So this is a living environment, community circumstances, whether the services are available or not, the living environment, whether it is favorable or not, and the condition in society, their economic, whether the people are rich, they can afford or not. And at this very stage, this comes very personal. The personal factors, the lifestyle, the genetics, individual education, its occupation, socialization, and whether the support system is available or not. And at this very stage, the preclinical stage, here the biological onset of the disease occur, and later on this is called a subclinical, a preclinical phase, and this one is the clinical phase when the signs and symptoms appear. And later on, the person is diagnosed when having the sign and symptom, then therapy is initiated, and the initial outcome either in the post-clinical phase, what happens, whether the person will be recovered, will go towards disability, and then handicap. So these are the different, steps or stages where the person has to go through. So if there is a good environment, good personal factors, early detection of the disease, and there is therapy available, then there is a full recovery of the disease. And if the therapy is not available, then the person may go towards impairment, and then the disability, and then the handicap. So the social environmental determinant, risk protective factors, here the social and environmental determinants, for that you have to take an intervention as a primordial prevention, where you are working on the risk factors. So after societal structure and thereby underlying determinants. So these are the risk factors you have to work on. And here the risk and protective factors are the primary prevention. If the person is with unhygienic condition, as I've already discussed in the previous slide, unhygienic condition, he or she should take intervention to keep themselves clean and neat. And for other, genetic is a non-modifiable factor, but those factors which are modifiable, you can modify those in the primordial prevention. For example, obesity you can modify. Other, for example, smoking you can modify, but the age, genetic, you cannot modify. In the primary prevention, there is no onset of the disease, but you have to prevent in advance. Secondary prevention, detect and treatment pathological process at an earlier stage when treatment cannot be effective. It is the stage where you can detect the disease and you can take an immediate action for treating the patient. And the tertiary prevention, which is, in the last clinical stage or post-clinical stage, where to prevent relapses and further deterioration via follow-up care and rehabilitation. Physical therapy is one of the best, tertiary prevention for a patient with cardiac. And there are so many examples where for different conditions, there are different, measure for tertiary prevention. So whatever is suitable for the patient, you have to go for that. And these are the references. Thank you very much. Please, if you like the video, share it with other learners. It may benefit those people who are closer to you. So if they learn even a word from these slides, that is, a kind of virtue for me. And that will bring betterment for me, if not in this world, maybe in the world after death. So I'll be happy with that. If somebody picks anything from these slides, that will give me really an internal happiness. Thank you very much.